Hello everyone. Today we will talk about basic principles treatment of patients with tuberculosis, dispensary observation of patients and individuals at risk. History of this question, treatment of patients with tuberculosis have two periods. The first one, pre-antibacterial periods, when doctors used of non-specific anti-inflammatory drugs, and antibacterial periods, or the periods of active use of specific anti-tuberculosis drugs. Over a long period, about 50 years, the leading method of treating pulmonary tuberculosis was collapsotherapy. The introduction of pneumothorax in our country is associated with the names of Rubel and Stenberg. As this picture, you can see pneumothorax on the right side and pneumoperitoneum. At this picture, you can see the doctors, Waxman and Schatz, which discovery of streptomycin. In the 90s of the last century and in the early 2000s, problems arose, increasing incidence of tuberculosis in general, with multi-drugs resistance in particular. The emergence of cases of extensive drugs resistance. There is an acute shortage of medical resources, anti-tuberculosis drugs, and diagnostics too. Over the course of a decade, the technical re-equipment of the service took place, provision of bacterial service with modern diagnostic systems for testing drug sensitive, which subsequently made it possible to individualize the approach to chemotherapy at an early date and to change the treatment tactic in a timely manner. Cooperation with the WHO and international organizations was expanded and became possible for the Russian Federation to participate in the following WHO projects. You can see this picture. Chemotherapy is the main component of TB treatment, regardless of the locations of the infections process, and consists in the long-term use of a combination of drugs that suppress the reproduction of MBT or destroy them in the patient body. At this picture, you can see stage of development of chemotherapy. And the cure of TB patient depends on two interrelated factors. The second one, suppression of the multiplying mycobacterial population with the help of anti-tuberculosis chemotherapy drugs. Regression of tuberculosis change in the effect with the development of reparative process. Treatment of patient. The first classification of anti-tuberculosis drugs involved the division of drugs into two groups: drugs of the first line and drugs of the second line. Criteria for the effectiveness of the treatment of patients with tuberculosis. Disappearance of clinical and laboratory signs of tuberculosis inflammation. Persistence, settlements of bacterial extraction confirmed by microscopic and cultural studies. Regression of radiographic manifestation and restoration of functionality, and ability to walk. Treatment of TB patient is carried out in a complex chemotherapy, surgery, pathogenic therapy, treatment of comorbidity. The content of treatment is determined by standards, treatment requirements for certain groups of patients, taking into account the form and phase of the process. It is very important within the limits of the standards, individuation of treatment tactic is carried out, taking into account the characteristic of the dynamic of the disease, pharmacokinetics of drugs, and so on. This principle allows you to combine the standards of treatment of the disease and individual objective of treating the patient. Basic principles of chemotherapy. Chemotherapy is the main component of TB treatment and consists in the use of drugs that suppress the reproduction of MBT or destroy them in the body. Chemotherapy should be started as soon as possible after the diagnostic and an antibacterial institution and can be combined. Well, we can see what consists of two phases with different objects, the intensive therapy phase and continual phase of therapy. Basic principle of chemotherapy. Antituberculosis drugs are divided into basic and reserve. The chemotherapy regimen is a combination of antituberculosis drugs, the duration of the administration, and timing and conduct of control examinations. In process of chemotherapy, it is important to control the medical staff over the intake of antituberculosis drugs. Classification of antituberculosis drug. Main drugs is streptomycin, and you can see at this picture another one, and they are prescribed in the form of separated of combined dosage form. Backup drugs, you can see at this picture too, apply under the supervision of an antituberculosis institution. Groups of TB patients are determined depending on the following criteria. The first one is epidemiological gender of the patient. The second one is TB drugs resistance to antituberculosis drugs. The third one is information about the history of this disease. And 41 is form, prevalence, severity of the tuberculosis process. Multi-drugs resistance of mycobacteria is resistance to the action of isoniazid and rifampicin, and more recently, only rifampicin, since as a rule, combined resistance to isoniazid is assumed without resistance to any other antibacterial drugs. Chemotherapy of tuberculosis. Abbreviation for drugs, you can see this picture. It is important to know. A few years ago, chemotherapy regimen existed. You can see this picture standard for treatment. It is very hard to understand, but you can look at this and forget. Time is moving forward. There are other defining criteria. The main criterion is the resistance of the MBT to antituberculosis drugs. This is an atypical specific therapy using an optimal combination of anti-tuberculosis drugs, which is aimed at the destruction of the mycobacterial population. You can see this picture. We have best results of drug sensitive or risk assessments of MDR in its absence. Chemotherapy regimen. Models without DCT data should be the rule, but the exception. Basic principle of TB chemotherapy: early starts, optimal duration and continuity, the use of a combination of drugs, complexity, treatment control. CT according to the results of repeat methods, standards approaches, combination chemotherapy, biphased chemotherapy, inclusion of the empiric regimen, accounting for LUMBT data with a contact person, accounting for information about previous therapy, timely correction in case of detection of DRMBT. In newly diagnosed patient with timely diagnosis of TB and immediately initiation of treatment, the intensive phase is 2 or 4 months. The continuation phase is 4 or 6 months. With late detection of the disease, detection of LU, the duration of therapy as a rule should be significantly increases, often up to several years. The combined use of drugs with different mechanisms of action outside and intracellular is the most important rule of tuberculosis chemotherapy. The total bacteriostatic and bacterial effects have always expected the result of treatment with one drug. A single daily dose of medicine is especially important in the first phase of treatment. Benefits of treatment with combination drugs is a method of condition combined chemotherapy. Single dose is conversation to use for both the patient and the honey personnel. The drug load of the patient is reduced from 50, 60, or 4 or 5 tablets. Fixed doses increase the likelihood of complication with the treatment regimen, promoters and prevent MBT drugs resistance. The appointment and correction of the CT regimen is carried out in 2 stages, based in individual DCT data obtained using molecular genetic method, based on the result of DCT on liquid or solid nutrients, media for drugs of the main and reserved series, the use of repeat methods of the diagnosis of MDR-TB gives 3-5 prevent death and clinical outcome. The introduction of ME drugs sensitive diagnostic load start chemotherapy region 4 to 3 months early, reduce the increase in MDR XDR-TB due to use of an effective chemotherapy regimen, and so on. The first one of principle of chemotherapy for patient is the intensive phase of treatment should include at least 4 effects in second line anti-tuberculosis drugs. the drugs is considered effective with the highest probability if MBT are sensitive to these drugs according MBT sensitive to drugs with high cross resistance, and the drugs was not part of ineffective regimen for passion, or the drugs was not part of an inadequate chemotherapy regimen. You can see these pictures, something principle of chemistry too. And the most effective regimen of the patient with MDR-TB includes 5 drugs, including aminoglycoside, polypeptide, levofloxacin, moxifloxacin, pyrazinamide, cycloserine, tirizidazine, or PAS. Standard chemotherapy regimen. You can see this picture. In the intensive phase, 6 drugs are prescribed with small forms by microscopy and seeding. The duration of the intensive phase can be reduced to 3 months. In the continual phase, treatment is carried out with carbamazepine with at least 4 drugs, and so on. Customized format chemotherapy is prescribed with no culture of MGM data for determining MBT drugs, resistance to first-line drugs and second-line drugs. Chemotherapy for tuberculosis is not feasible without a rational genetic and dietary regimen, without the addition of non-specific pathogenic and symptomatic drugs, show in some cases of collapse therapy or surgery. Pathogenic treatment in tuberculosis is used for the complex treatment of patients in increasing the effectiveness of treatment through the use of means or method that affect not the causative agent of the disease, but the state of various systems of the patient body. Non-drug method, which we can see at the last picture. And this method is combined with the hospital regime, medical nutrition, collapse therapy, aerosol therapy, physiotherapy, the impact of climate, and other sanitary facts. Medical method. Drug therapy is irrigation solution, non-steroid anti-inflammatory and anti-hematoxis drugs, enzyme preparation, vitamins, antioxidants drugs that affects metabolism, preparation for the treatment of itching, and so on. Hormonal therapy is steroid hormones. You can see this picture, and anabolic preparation, and against the background of infusion, administration of protein preparation. You can see this picture, pneumoperitoneum and pneumothorax. Method of collapse therapy, artificial pneumothorax and pneumoperitoneum is a method of treatment which consists in introduction air source a needle into the chest between the parietal and visceral pleura. PP is a method of treatment which consists in introduction ear inserts a needle into the abdominal cavity. Indication for the imposition of IP: destructive TBL in the presence of a fresh cavity without significant fibrous completion of the lungs, and so on. You can see this picture. And what is important of IP? Clinical forms: causes pneumonia, ketosis, pulmonary tuberculosis, exudative and adhesive pleurisy on the site of application. For currents, size over 6 cm, located in hepatic areas of the lungs, blocked currents. Indication for the imposing of PP: cavernous and infiltrative tuberculosis in the face of disintegration of the lower lobe localization. Disseminated pulmonary tuberculosis: patient with partial resection of the lungs to temporarily reduce the volume of the chest cavity for the purpose of relaxation or not removed segment. You can see this picture what is important of IP. It's just like emphysema, pneumococci, bronchial stenosis, and so on. And important to know that the patient age is over 60 years. Miliary tuberculosis is imposition of PP, and so on. You can see this picture over bronchoplasty. It is a method of creating therapeutic hypoventilation in the affected area of the lungs while maintaining the drainage function of the bronchus by installing an endobronchial valve. Technology is used as minimally invasive non-drugs method in the treatment of destructive change in TBL. You can see this picture history. And surgery treatment of pulmonary tuberculosis: the first successful thoracoplasty was performed in Germany by Southbrush. Surgery treatment is a component of complex treatment of tuberculosis. The use of the possibility and timidity of surgery intervention is decided by the VC with the participation of a thoracic surgeon and a physiatrist before the start of chemotherapy and during chemotherapy. Surgery treatment of pulmonary tuberculosis: lungs resection, thoracoplasty, and so on. Surgery treatment, you can see this picture. Video thoracoscopic sanitation of tuberculosic emphysema. Complication and consequential of the tuberculosis process, surgery treatment, pulmonary bleeding, broncholytics, and so on. In this picture, you can see group of observation of patient and person at risk for the development of TB. It's important to know too. Thank you. Goodbye.